Thank you, Chris, and thank you, members of the media. We really appreciate, once again, meeting with us, and this time a little bit on short notice, so really appreciate that you've given us your time. I'm once again here at the Cross Insurance Center. I want people to understand that the Cross Insurance Center in Bangor is still open. We are giving, if you received your first dose at the Cross Insurance Center, you are to return to the Cross Insurance Center to receive your second dose. I understand there's been a little bit of confusion about that. But yes, indeed, the Cross Insurance Center here in Bangor is open, as are other clinics where people have received their first dose. They should proceed there for their second dose. We'll get into clinics in just a little bit. Just talk about some numbers. Currently, right now, Northern Light Health is caring for 24 individuals within our inpatient care who are positive for COVID-19. One of those is at A.R. Gould Hospital, one at C.A. Dean Hospital, 8 at Eastern Maine Medical Center, 3 at Inland Hospital, 2 at Mayo Hospital, 8 at Mercy Hospital, and 1 at Sebasticook Valley. In addition, our home care and hospice team are taking care of 4 individuals at home who are positive for COVID-19. As you can see from those numbers, very spread out across the state and across our health system. So we are not through the end of this pandemic, and so it is important that we continue to try to be safe and remain vigilant. I'll give you a quick vaccine update as of 5/11. Northern Light had administered a total of 224,884 doses. That represented 120,557 first doses and 104,327 second doses. In addition, Northern Light Medical Transport has administered 473 doses, and our hospice and home care and hospice team has delivered 24,444 doses. So we are very proud of those numbers, and again, very proud that Maine continues to lead the way in percent of population vaccinated. And we have some good news on that front. As of today, the Maine CDC has announced that the Pfizer COVID-19 vaccine has been authorized for use in those ages 12 and above, and we're excited to offer the vaccine to this age group starting today to further protect our communities. Community members under the age of 16 must be accompanied by an adult to their vaccine appointment, whether it is scheduled or walk-in. You may want to complete the consent form before arrival, and you can print that out by visiting covid.northernlight.org. It's the same where you can do the scheduling. Walk-in appointments for those under the age of 16 are available immediately at all of our locations that are currently offering first dose vaccination. So you need to be clear that you're at a site that's currently doing first dose vaccinations. Our scheduling website was updated this morning to allow appointments for those under the age of 16 starting today. While younger community members are at lower risk for more serious side effects of COVID-19, they play an important role in keeping our more vulnerable friends and family safe. The more who are vaccinated against COVID-19, the less the virus can spread, slowing the further mutation of the virus and reducing risk for all of us. While it is rare, children and teens can get severely ill from COVID-19 and have multi-system complications, including needing to be hospitalized in our critical care settings. And unfortunately, we know there are children who have died of this. If you have questions about your vaccinations for you or your child, please reach out to your primary care provider, where they can talk over specific health care needs and whether the vaccine is right for you. There will always be members of our community who cannot be vaccinated due to allergies or illness, and people whose immune systems cannot build up the same response after vaccination to protect them against COVID-19. And it is for these people that we all should consider being vaccinated. Now that more than half of Maine's eligible population has been vaccinated, it is a reminder that we are shifting away from our large centralized vaccination sites. Starting today, Tuesday, May 11th, we began offering first dose of vaccines at the Northern Light Health Center at 885 Union Street in Bangor. The new vaccination site will be easy to access and efficient, just like our Cross Insurance Center site. There is plenty of signage to direct people to the vaccination area. Walk-in appointments will be available, but as I mentioned beforehand, please save time by registering online. That will make the process a lot smoother. Our last first dose vaccination clinic at Cross Insurance Center took place on the week of May the 6th. The Cross Insurance Center, as I said, will remain the location for those who received their first dose at that location, but still require their second dose. We anticipate widening down our Cross Insurance Center vaccine site for our second doses on May 27th. For a period of time, we'll be operating both the Cross Insurance Center and Union Street, and we will provide clear communication on site when people receive a first dose as to the location of their second dose, so there will be no confusion. Similarly, we will be doing this at our sites across the state of Maine, and so please make sure that you are checking in on our website for further information, and we will contact those if we have to change a clinic site for any particular reason. And with that, I'll open it up to questions.
Thank you very much, Dr. Jarvis. We'll start with TJ Tremble from WVII.
Thank you, Chris. Good afternoon, Dr. Jarvis.
Good morning, TJ.
Just a question regarding if you have any indication of what the percentage of Northern Light employees, medical, food workers, custodial, who are not vaccinated.
So I don't have those specific numbers. We can certainly bring that back to you. Typically, I rely on another individual for the source of that information. And so I think I will just leave it at that we'll get back to you with those specifics. I will say that we have had individuals who have been vaccinated, very recently as well. Those who have been coming back from working remote and the like. Remember, it's always a matter of process for us because we always have new employees coming in, as well as we've had some employees who were working 100% remotely and therefore were not part of the original vaccination list for healthcare workers. But we've continued to see improvement in that number and proud of that fact.
Can you remind me, is it requirement for Northern Light employees to get vaccinated?
It is not. At this time, we've not made that determination. We are continuing to follow the data. We have been supportive of all of our staff and providers to be vaccinated and have seen a tremendous uptake in vaccination rates for those particular populations. And so we have not discussed that as a matter of course going forward. And so right now, no, it is not required, but we strongly encourage all healthcare providers and workers to get vaccinated.
Thank you for your questions, TJ. Next up is Mel Meyer from WGME.
Yes, thank you, Dr. Jarvis. My questions are about obviously the teens, the tweens getting their vaccines. What do you say to families who are now concerned about how long these vaccines were tested for? There were some parents that are concerned about just how long they've been tested for the clinical trials. And also, can you speak to the size of these clinical trials for younger people?
Yeah, that's a great question. So I just want to be clear that no corners were cut when we talked about trials or safety or efficacy for these particular vaccines. While it appears that they came to market very rapidly, most of that has to do with the newer technology used to develop these vaccines, the amount of money and support that governments around the world, including the Trump administration's Operation Warp Speed, gave to companies to entice them to ramp up production at the same time that they are running clinical trials so that things could come to market as soon as these vaccines were determined to be safe. Tens of thousands of individuals, including people with the age group that we're talking about, 12 to 16-year-olds, were enrolled in these clinical trials. Initially, they started off with older people, and that's the reason why we were able to start vaccinating those 18 and over initially, 16 and over for those with the Pfizer vaccine. Because those were the people initially enrolled. It took us a little bit of a while to enroll some younger individuals, and that's the data that we have now from Pfizer. I want to say that the number of individuals enrolled in these trials was equal to or greater than most of the trials that we talk about when we talk about everyday medications that come to market that people take for their blood pressure, for their heart disease, for their diabetes. So these were very good clinical trials. Not only that, they were well scrutinized. Most of the time, nobody ever asks for the data about something that comes to market in terms of medication or vaccine. So these were heavily scrutinized. We know the data is real. We know the data shows that these vaccines were safe and that they were effective. We know that there's a slight difference in the immune system between children and adults, but we also know that children handle vaccines very well. In fact, the majority of vaccines are given to children during their infancy as part of routine vaccination against diseases that we know harm children. So I want people to understand vaccines in general are safe, very safe. And these vaccines now have been used on hundreds of millions of people, way more than the clinical trials we would do for any other vaccine or medication. We have enough data here to feel very confident that not only are they effective in preventing serious disease and death from COVID-19, but they are safe when they do that. So I'm going to say that once again. These are safe. The data is clear. It is time for everyone who is eligible to be vaccinated, and now we can add to that list kids who are 12 to 16 years old.
And then my other question, I talked to one family that was hesitant to get one of their newly eligible kids vaccinated. Can you explain what's the difference between the emergency use authorization and full FDA approval? Should that impact people's decisions?
That's an excellent question. And I know there are some people who are out there waiting for full FDA approval. I will say that the process that was used to give emergency use authorization was the same process and the same people that do full approval from the FDA. But we needed this done in a timely fashion. And typically, because of the way our bureaucracy works, it takes time for them to get through all of those steps and hoops in order to give full approval. What we saw here is that those groups got together much faster than they normally would to review the data. And remember, the data was reviewed by the FDA Advisory Committee and from the Advisory Council on Immunization Practices. Those are two independent bodies and came to the same conclusion. The vaccines are safe and effective. Now, the FDA Advisory Committee is who gave the emergency use extension to 12 to 16-year-olds yesterday, and the ACIP will meet tomorrow. We expect that they will simply confirm what the FDA has already said. What this actually shows is that our government worked for us. We were in a pandemic, a state of emergency, where unfortunately over 500,000 Americans have lost their lives. And they got together and did what we ask of them: keep us safe and protected. And so they reviewed the safety profile and the data, found these vaccines are safe and effective, and therefore gave emergency use authorization. The emergency part of that means that they did it rapidly, not that it was only to be used in emergencies, though I will say this is the greatest loss of life we have ever seen in American history from a single entity, far more than any war or any other disease we have seen before in a single year. And so therefore, this is our single best way to prevent that from happening in 2021. So thank you.
Thank you for those questions, Mal. And now we have Mary Kate Mannion from WNTW.
Hello, good afternoon, Dr. Jarvis.
Hi, Mary
if I could
Kate.
ask you, hi, if I could ask, you touched on this a bit, but why should kids this age, 12 and up, get vaccinated against COVID-19?
Well, the single answer is because they need to be protected. But the greater answer to that is what can they do for communities? Most 12 to 16-year-olds live with somebody, and that someone probably has some kind of pre-existing condition, whether that be high blood pressure, diabetes, obesity, age over 70, live with somebody who is pregnant or may become pregnant, or somebody younger than them. All of those are high-risk groups for severe effects from COVID-19. And then let's just talk about the 12 to 16-year-olds themselves. They have spent a year where they have had on and off again school because of outbreaks in our communities. We don't want that to happen again. We want them to start in the fall knowing that they will attend classes in person for the entire year. The only way that can happen is enough of them are vaccinated that we don't see these outbreaks amongst them and their friends and their families. And so that's what I'm saying to them. If you want that sense of normalcy again, if you want to get back to your child playing sports or having concerts or just getting the formal education that they all need for their natural development, they need to be vaccinated so that they can stay safe, we can keep our schools open, we can start playing sports on a regular basis, and we can all get back to the way life is supposed to be. So thank you, Mary Kate. Did you have a follow-up, Mary Kate?
Oh, I don't hear anything from Mary Kate. I don't know if she's having some audio issues, but we'll move on. Mary Kate, if you had something else you want to ask, just get to put it in the text box, and we'll get to it at the end. I believe next up is Kate. No, I'm sorry. It's Joe Lawler from Portland Press Herald. Joe, just give me a second to unmute you, and then go ahead.
Yes, hi, thanks. I have two questions today. One is Maine is starting, and you mentioned at the beginning that Northern Light, including, is starting to immunize 12 to 15-year-olds today and tomorrow. But a lot of places are not starting till after the ACIP meeting on Wednesday to, start Thursday. Can you explain why why that is, why some places are waiting till Thursday, and why Maine is starting earlier. If you could explain that.
Yeah, so I certainly was involved in discussions with the state yesterday evening after the FDA had extended their emergency use authorization to this particular age group. But I believe this was all handled at the state level. I know that our state officials were in contact with the CDC, the FDA, and with the White House yesterday, and ultimately came to the decision that here in the state of Maine, we wanted to vaccinate people who are willing to get vaccinated as soon as possible. And therefore, because we don't expect that the ACIP will make any changes or further recommendations, I will say that from a Northern Light Health standpoint, we will follow the guidance of the Maine CDC, but we will certainly monitor what the ACIP comes out with in their meeting tomorrow. And if they put any particular recommendations on, we will certainly take that under advisement and work with our cohorts around the state, including the Maine CDC, if we need to make any changes. Again, we don't anticipate that. This was a long coming authorization. We've been expecting it really since the end of April. There was a couple of reasons why the FDA did not receive the request from Pfizer, and some of that had to do with the Johnson & Johnson pause and a couple of other issues. But again, we were expecting this. This is what we've been waiting for. And in fact, all of us have been prepared to be able to turn the switch and allow 12 and older to be vaccinated.
Okay, great. And my follow-up question is, I know that Northern Light is planning on doing clinics for ages 12 and up in schools, right in the schools. And there's just enough time to do this before the school year runs out. So I don't know if there's any kind of details you can provide on that, like how many school districts you're going to be doing within the next week or so, and maybe some names of some schools that you're partnering with to offer in-school clinics.
So that's an excellent question. So I don't have the full details on that. And in fact, it continues to change on a regular basis as more schools reach out to us. I will say that really we've worked together as a state in this endeavor. So we have made sure that where Maine Health and Northern Light Health overlap, that we are working in coordination to make sure that schools are taken care of. Here in the Bangor region, Penobscot Community Health Center has actually been the leading agent in going out and vaccinating at schools, and we will provide support to them in doing so. There are some areas where only Northern Light has a presence, and so in those particular places we have reached out to those schools. Similarly, Maine Health has done the same. I will say that in the southern part of the state, our home care and hospice has always been one of the leaders in vaccinating within schools when we talk about influenza season, and so they have taken the lead role there. But each of our hospitals that have had vaccine clinics will continue to reach out to the schools in their particular area. I would refer you to our website for information, and also to the school's website. Really, we're going to see these as school clinics and not Northern Light clinics or Maine Health clinics or state-run clinics. We really see this as the school running a clinic and us offering the support, and we anticipate that schools will be sending information out to parents and guardians for when they have those clinics and where they can sign up, and then also to make sure that parental consent is signed. It will be a little bit different in each area because, like I said, the lead agency will be different in each area. It may be a Northern Light agency, it may be a Maine Health agency, it may be one of the other health systems, and it may be Penobscot Community Health Center or other similar federally qualified health center in the area. So I really ask you to reach out to the school and ask what their plans are, but I believe we have reached just about every school in every region. I will say that actually up in Presque Isle, A.R. Gould has already started to vaccinate in schools, and they will now extend that out to the age category of 12 to 16.
Okay, thank you for your questions, Joe. So Dr. Jarvis, I'm going to go back to Mary Kate Mannion's question. I actually muted her because there was some feedback that came out. But her question she sent to me in the chat is, could you speak to the side effects of the vaccine for this age group? Thank you.
Yeah, so the reports really don't say any significant difference in side effects than we've seen with any other age category. So most people will experience some soreness at the administration site. Some people will actually have a little bit more intense pain in that particular arm. And then that goes all the way up to people who feel fatigued afterwards, get a mild headache afterwards, to those who really have flu-like symptoms where they'll have chills as well as muscle ache and just feel generally unwell, and up to and including having fevers. All of that can be mitigated with acetaminophen or ibuprofen if needed, though we caution people in taking that right off the bat. I usually say just wait to see if the symptoms are worse than you can tolerate, and then taking one of those medications. And again, no way to predict who it is that's going to have any of those side effects, but truthfully, serious side effects have been minimal. And again, the studies for this particular age population did not see any serious side effects, or they wouldn't have gotten emergency use authorization extension with such a quick turnaround as we saw this week.
Okay, and next up we're going to go to Caitlin Andrews from Bangor Daily News.
Hey, good afternoon, Dr. Jarvis.
Good afternoon.
I was wondering if you could talk a little bit about what kind of challenges you might see in vaccinating younger children. You know, what I guess factors are there when you're trying to reach this particular age group that you see could be a challenge in vaccinating them, or a benefit in getting them vaccinated, things like that.
Great. I think the biggest challenge we're going to face is the same one we see in healthcare all the time from this age category and younger, is that unfortunately the delivery of our healthcare system is inequitable, and we need to work on that, and we will try to make the vaccination process as equitable as possible. But parents work, kids go to school, it makes it difficult to get them to places, and that's the reason why we're doing outreach, particularly at schools. We will continue to do outreach as well at businesses, and if there are businesses out there that would like to decide whether or not they can have clinics on site, whether that be for employees or employers or employees and families, please reach out to Northern Light Health Work Health Division, and they can certainly help set that up. So really, the biggest problem we're going to have, again, is outreach. I think there's going to also be some issues with vaccine hesitancy. If a parent themselves is concerned about getting the vaccine for themselves, they'll probably extend out to their children. But once again, these vaccines are extremely safe. They are well studied. We have more data for these vaccines than we have for most other medications that when they first come to market. And we have now had hundreds of millions of people around the globe who have been vaccinated without seeing any serious consequences. This is the right thing to do and the needed thing to do. So thank you.
Okay, and my second question is, so the vaccine is only the Pfizer vaccine is eligible for these children. So that's obviously like 1 out of the 3 options that we have. Do you see that being a challenge as we try to keep vaccinating other people, or do we have enough vaccine at this point where we should be able to reach this group no problem?
That's a great question. As you know, in the beginning part of the vaccination process, all I ever talked about was vaccine supply. I haven't mentioned vaccine supply at all during this press conference, and that's because we do have an adequate supply, and that supply continues. Pfizer has been able to ramp up production and has been able to keep vaccine in, and unfortunately, as we've seen, we've hit that vaccine hesitancy mark. Many other states hit when they only had about a third of their population that was eligible vaccinated. We didn't hit that until after half of our eligible patient population was vaccinated. So again, kudos to the people of Maine. They're standing up, they're doing the right thing. But we have vaccine on hand at all of our Northern Light sites. And then across the state as well. So we feel that we can partner up very well. As I mentioned, when we talk about the school-based clinics, many of us, including Eastern Maine Medical Center here in Bangor, will be providing a support role to Penobscot Community Health Center in their delivery of vaccine. So we can manage getting vaccine to the people who want it. That is not going to be an issue for us going forward, we do not think, and we're delighted by that. I will say also the state got an increased supply of Johnson & Johnson vaccine. So for those over the age of 18, if they only want to get that one shot, that's available, and we continue to have supply of Moderna. So right now is a good time to get vaccinated because we still have a few of our large-scale clinics open. We have some of our smaller clinics open. We are now providing this in doctors' offices as well as going out into the community and doing pop-up clinics out there. So please, if you're thinking about getting the vaccine, now's the time to do it when we have plenty of supply and many places around the state that are able to administer vaccine. I will say that's a good point, though, about the Pfizer vaccine. You will need to make sure that you're signing up anybody under the age of 18 for a Pfizer-only clinic, because that's the only thing that anybody under the age of 18 currently has authorization to be administered. So great chance for me to remind people of that. Thank you.
Thank you for your questions, Caitlin. Next is Brittany McHatton from WABI.
Dr. Jarvis, thank you so much for taking our questions today.
Always.
Well, one of the major misinformation themes that we've been seeing is about vaccines and fertility, seeing as this age group is the age group of kids going through puberty, can you speak to any risks or lack thereof of the vaccine on children's development in that capacity?
So thank you so much for giving me the opportunity to talk about that very important issue. So first and foremost, to be clear, there is no risk of fertility issues for people who are vaccinated against COVID-19. Now I'll go into specifics. One, we know that there are many women who were vaccinated in the initial trials and since the vaccines have been given authorized use, who have become pregnant. There was a recent report that just came out that just stated that looking at women who were vaccinated versus women who were not, that the rate of miscarriage was similar between the two groups, meaning that there was no greater risk for miscarriage for women who were vaccinated versus those who were not. Plus, we look at the science and the biology. The way that all of these vaccines work should not affect fertility just by simple biology. When we look at specifically the mRNA vaccines, which is the Pfizer and the Moderna vaccine, so specifically the Pfizer for this age group, it is a messenger RNA that goes absorbed immediately into your muscle cells, and after it does its job of becoming the blueprint for that spike protein that we all see on those pictures of the coronavirus, it immediately gets degraded. So it has no way of getting to the part of the body where fertility lies, and therefore could not affect it. We also know that millions of people have been infected with COVID-19 around the world, and yet we have not seen that COVID-19 itself has had fertility issues, except in those individuals who were extremely sick and had consequences from their illness, not consequences from the virus. So even though the vaccines we currently have all create that spike protein within us, there is no way that it has a fertility issue because that's not what the virus does. And this is just a part of that virus that just can't replicate anymore to create any more viruses or illnesses. And again, the vaccines themselves have been shown to be safe and effective, and we have not seen any evidence of fertility issues or miscarriage issues with these vaccines. That should be clear, it's concise, and thank you again for bringing that very important topic up.
Well, thank you, Dr. Jarvis. Last one from me is, I know that you are just starting today of this vaccinating this age group. Any indications at all when even kids even younger could start being eligible for this particular Pfizer vaccine?
We know that Pfizer, Moderna, and Johnson & Johnson are all doing clinical trials with age groups even younger than the age of 12. It's just a matter of how much data they've collected and when they feel they have enough evidence to prove that the vaccines are safe in those age categories. We don't expect that they wouldn't be safe in any younger age category. I expect that as the coming months come on, particularly through the summer, we'll probably be seeing more vaccines available to people who are younger, and particularly younger ages than 12. I don't have a timeline on that. As much as we kind of predicted the 12 to 16-year-olds, it was a little bit easier to follow those trials than it was for that younger age category. But I presume over the summer we'll see a little bit more. So why the big push right now to get the Pfizer vaccine into this age category? Because as somebody already mentioned, we know that the end of the school year is coming. We know for a lot of people it's difficult for them to get health care over the summer months for a varied amount of reasons. If we can provide vaccinations in the school, get that second shot in before schools close for the summer, we know those kids are protected all summer long while they're out there doing those fun things that kids like to do, while people do their summer vacations, and then they'll be prepared for school in the fall.
Thank you very much for those questions, Brittany. Next up is Charlie Hayaker from Maine Public.
Yeah, hey, thank you, Dr. Jarvis.
Hey, Charlie, how are you?
Good, how are you?
I'm well. It's a good day.
Yeah. A pretty quick question for me, which is just, can you remind me, and you've touched on this in various ways, sort of what are the, where is Northern Light offering vaccines in the state right now? Just like a general kind of rundown of the places you have. So
I will say that anywhere that we have one of our hospitals, there is a vaccine clinic nearby. So it is changing a little bit. So some of our large-scale sites have actually already closed completely because they have finished out their second doses. But within a short drive of any of our hospitals, we continue to provide vaccination. So you can think about the 10 locations that we have hospitals. In addition to that, we have already started to give some vaccine out into some of our practices as well. People will have to reach out to that particular practice to determine whether or not vaccine is available there. We will share an infographic with you after the close of this briefing that actually shows the locations where our transition were from our mass vax to where we're going to be doing vaccines now, and you'll actually see that we've broadened our reach rather than contracted it with our newer sites.
Okay, and that's it for me. Thank you again.
Thank you, Charlie.
Thank you, Charlie. Next up, we're going to go to Leslie Landergren from Penobscot Bay Press.
Hi, Dr. Jarvis.
Hi, Leslie.
Hi. I'm wondering, are you just planning to do clinics with schools during the school year until it ends, or do you have any plans to continue through the summer?
That's a very good question. As a state, we have discussed some of that, and we'll just continue to tailor. As you've heard me say, time and time again, Northern Light Health will continue to vaccinate until every last Mainer who wants a vaccine gets vaccinated, and so we will do whatever it is that it takes to do that. A little bit more difficult when it comes to trying to utilize schools and things like that after the closure for the summer. But we will continue to work with our partners around the state to find more and more ways that we can reach more individuals. And I hope that the governor discusses that in her press conferences today about how we can do even further outreach than we already have been doing. We know there are individuals out there who want to be vaccinated, but because of access, it has been difficult for them. We need to make that easier, and we will continue to strive to do so.
Thanks. And for school children who are getting vaccinated, will there be any cost to them or their families?
No, there is no cost to this vaccine whatsoever. I know that we do ask for insurance information, and that's because the administration of the vaccine does have costs to us as healthcare agencies that are administering them, but that will only be passed on to people's insurers. No family, no individual will ever have an out-of-pocket cost for receiving a COVID-19 vaccine, at least at the current time. I will say that if anybody does get a bill for the administration of a vaccine, they need to reach from Northern Light Health. They need to reach out to Northern Light Health's patient account services, and we will rectify that as soon as possible.
Okay, thank you for your questions, Leslie. And last but not least, we are going to move on to Amy Brown from WERU.
Thank you. Hi, Dr. Jarvis.
Hello.
Hi. My other question has already been asked, but I'm wondering also if you have a rough estimate of how many people who were considered to have some type of immediate reaction to the vaccine were actually having anxiety-based reactions, fainting because of needles or panic attacks, that type of thing.
Again, I try to do science first, so I don't have specific numbers there, but I will say anecdotally at the center that has administered over 100,000 vaccines, the overwhelming majority of immediate reactions that required our attention were really due to emotion and anxiety, and not through anything that had to do with the biology of the vaccine itself or the administration of that vaccine. In fact, we've been asked before, has anybody needed to be admitted to the hospital afterwards? We have no numbers that say that there were anybody who had to be admitted to the hospital afterwards. And those people who did have significant medical issues after it all had pre-existing conditions that they actually alerted us to prior to the vaccine administration. And so very uncommon for any kind of event after the vaccine that requires initial medical attention or has severity. And then we know that long-term issues, we've seen no severe consequences from any of the vaccines that are currently available, and particularly the Pfizer vaccine, which is now eligible for individuals over the age of 12.
Thank you very much for your question, Amy. I believe that is going to conclude our virtual media briefing. We ran a little bit long, and I understand the governor has a press conference at 1 o'clock that I'm sure some of you are probably anxious to get to and attend. Dr. Jarvis, any final closing words before we wrap up?
Yeah, I certainly have been a little bit more passionate during this particular press conference than we typically have, and that stems from the fact that, one, I am overly excited that now we can vaccinate those individuals 12 and above, and that's a great thing for us. It just protects that many more people around the state of Maine, and also just simply because this is the right time. This is what we need to do. So once again, thank you for getting our message out there. I will end with, these vaccines are safe and effective, and the single best way we will end this pandemic. Thank you.